Okay. How many of you knew, and before I'm about to say it, that MAC is a Spanish translation for high quality doctors? MAC is also a network of medical facilities that have state-of-the-art diagnostics, state-of-the-art technology, state-of-the-art infrastructure, and highly skilled medical professionals. I know because I've been there. MAC is focused on world-class medical care that meets accredited, certified international standards. The range of their specialties includes cardiology, oncology, gastroenterology, orthopedics, neurology, and more. MAC is also known for medical tourism. MAC has a foundation that's doing some transformative work in social impact programs in the most vulnerable communities near MAC hospitals. They're bringing well-being and quality of life and better health to those folks who are most vulnerable. The foundation also contributes to projects that advance innovation in medicine. So today we have a whole slew of MAC people with us, I'm happy to tell you. First, you will hear from Licenciada Cristina Lugo, España, and then from Dr. Ricardo Aguirre, and then from, let's see, well, there's a whole bunch of them, so let me just name them. Jesus Antero, Dr. Juliana Flores, Dr. Grace Lim, and you all know that Grace Lim and her parents have been Citizens of the Year from this Rotary Club in the past, yes. Dr. Robert Maxwell, everybody knows Roberto, and they will answer your questions, so get them ready. Please help me welcome Licenciada Cristina. Cristina, it's good enough.
Good morning, everyone. My name is Cristina. Nice to meet you, everyone. Thanks for having us today. And we'll talk about a bit of our hospital today. Hospital MAC was founded in August of 2017, with one goal in mind, which was to give an appropriate and a comprehensive quality healthcare to the community and the people living here in San Miguel. Our mission as a hospital is to give a sustainable health services to our patients through our mission, vision, and values. Our mission as a hospital is to give sustainable health services to our patients, as prior mentioned, and our vision is to be a leading and innovative medical institution for everyone here in San Miguel. Our values, responsibility, commitment to the community, the people, and their health, honesty, quality, efficiency, and respect are also part of our daily service to the community. I mention all of this so that you can be reassured that we are eager to attend to your health needs so that you can live life to the fullest. But we alone aren't enough to give you all of that. This is a teamwork that we need to do together. You, your doctor, and us as a hospital. There is, well, obviously your role as a person, and a role as a medical advanced institute, and the role of your doctor. So, a preventative care and a mediated care will be part of your role and your doctor's role, which will be, your role will be the self-care and a request care. A self-care is primarily all the steps that you must follow to be in good health, like prevention with annual checkups, monitoring any treatment that you are following right now or you might need to follow in the meantime, or maybe some medication, therapy, going for a correct diagnosis with your doctor, doing moderate exercise so that you have a good condition, and some meditation for mind health and mindfulness. Okay. Who should I go to if I want to have a primary health care? Well, the primary health physician is the one that you should look for if you want to have a good primary health care, or start with your primary health care. So a family medicine doctor will be a good idea, or you can go to a general internal medicine doctor too, or if it's for the kids, your grandkids, maybe your niece, it will be a general pediatric doctor. Our hospital have more than 70 specialized doctors, and we have a lot of specialties, which will be, to mention some, internal medicine, nutrition, gynecology, cardiology, dermatology, oncology, pediatrics, and many more that you can see on the scheme right now. Now, how do I contact a doctor if I need to, or if I have a doubt, or if I don't feeling well, or how should I start, who should I contact? You can call us to the phone number and seek for the option 9, which is emergencies, and we can guide you on what to do, who doctor you may contact, and many more doubts that you may have on how to reach to us or to any of the doctors that we have with us at the hospital. For the ambulance, in case you may need it, we have our own ambulance for translating if you don't have the means to do that. And we also have a partnership with another ambulance that might help us in case we can reach you with the one that we have. Now, for medical guidance, we have Dr. Aguirre. If you want to know who to contact, we also have Dr. Lim and Dr. Maxwell, so that they can give you a clear idea of what to do, who to contact, or which medic you should go to see or have your primary health consultation. And for prices, surgeries, estimates, and our monthly promotions, which I will tell you more about it further in the speaking, you can contact me to any of the numbers, or you can call directly to the hospital and say that you would like to speak with the sales executive, and then they will transfer you with me, so that I can give you the information that you might be looking for. Now, about our hospital and more specific points, we have 17 rooms that are already on dispose, but if there is a need for more rooms, for more patients, in case, I don't know, maybe we have one more COVID case or something like that, we have 11 room more that are available and ready to be used, just in case of emergency, or in case that is needed. We also have isolated rooms for those type of cases, and another cases that might not be COVID, but that may need isolation room for the patient. We also have 2 operating rooms and 1 labor room. This is for maternity, but we can also use it for an emergency surgery that might be needed when the 2 operating rooms are occupied. We also have ICU, which is intensive care unit, yes, thank you. And we have 2 rooms, and inside the ICU, we have also 1 insulated room for that too. We have 3 rooms for NICU, which is neonatal intensive care units. We have that for the babies. And we have 3 cribs, likewise, for the babies. We also have alliance with a lot of insurance companies. Mostly nationals, but we also have contact with international insurances companies, so that if you have any doubts, you have to make sure that your insurance might be useful with us. You can contact us, talk with the persons in the invoice department, so that they can give you all the details, all the information, they can resolve your doubts. And the monthly promotions, these are for everyone. This is not like just focus on one person, or it could be anyone. Like, for example, this month we have 10% discount in rhinoplasty. So if you have any trouble with your nose, or you want to look a little bit more handsome, a little bit more prettier, you can call us to have an estimate in this. And also we have laboratory and imaging discounts. Each month we have a different one. Sometimes it could last 3 months, maybe 2 months, maybe a semester, or sometimes it's just monthly. You can check all of the monthly promotions on our Facebook pages, which is this one. You can look as MAC Hospital San Miguel de Allende, and then you will find us. If there is no English translation to the image, you can always ask in English in the inbox right below the image, and then we'll respond to your question. And well, we also have alliances with a lot of universities here in San Miguel. We work together for internships mostly, but we also go to health gatherings that then might prepare, and then will invite us, and then we will go, maybe some blood test for diabetes, a speed test to know your glucose level, your pressure, and we'll give you some advices so that you can go to your doctor. Now, MAC Foundation, because I know you might be very interested in our foundation. It's a non-profit organization. It's not here in San Miguel, it's in every MAC in Mexico. They will send us cases, and those cases, once they reach us and have the proper letter of acceptance, then we will receive the kids or the people that might be getting the surgery mentioned in the prior letter that we received. They have an ethical and human commitment with the community and all the people here in San Miguel and Mexico as well. And what they look for with this foundation is a positive, transformational, and significant social impact to the country's health. So for those in need who might not have enough money for, let's say, a renal transplantation, they might have the case with MAC Foundation, and they will study the case, and once they accept it, they might come to the MAC they assign for them to have that surgery. Well, this is part of what I just said. We are looking for a Mexico's health, wellness, and life quality of everyone here in Mexico, not just Mexican, but everyone that lives here in Mexico. And this foundation started more than 10 years ago with this work. We focus mainly in vulnerable communities, but it's not limited to them. It can be to anyone, but it's mainly focused on those communities. And we have, as today, free pediatric cardiovascular surgery. We have renal surgery and cleft lip surgery, among others that have been done. And these are some pictures on the before and after for a baby that was added from MAC Foundation to have a cleft lip surgery. This was last month, I can see it. This was last month. And we also have renal transplantation, and there have been 14 kidney transplantations from 2019 to 2023. For more info, because we don't have access to more info, and if you want to have more specific points, doubts, information, and so, you can contact Licenciada Ana Gomez, and that will be her email address, or you can go also to the Facebook page of MAC Foundation. You can write on the inbox, or you can write into the feed page so that they can reach you and answer on your questions. And that will be all for us. I hope that you like this presentation, and if you have any doubts, we're all ready to answer them. Thank you very much. Yes, yes, we do.
Yes, I'll be handing it out. Good afternoon. Good morning, everyone. My name is Jesus, and I'll hand it out.
Yes.
Good morning.
Good morning.
I have one question. So with such an aging population here and so many folks suffering from diabetes, I noticed that you don't have an endocrinologist. I myself suffer from thyroid issues. Is there any chance that we're going to get an endocrinologist here in San Miguel at MAC?
Well, I'm sorry. No, in this moment, no have one endocrinologist, but have Dr. Alim is internist, and this is a very good doctor. Well, Dr. Montes is now in the office to the MAC, Hospital MAC, is in another place. There is an endocrinologist here in San Miguel, Dr. Montes. And it's possible come to MAC to realize any appointment and see you in a MAC, maybe in emergency. No? And I think so you need know the hospital MAC is opening 7 days a week, 24 hours a day. Emergency room is opening and have all doctors to specialists or have a good studies for help to any situation, to emergency situations, for care you and immediately call to any specialist to continue to follow the treatment for any need. Or when you have any situation, please call to the numbers, the hospital numbers, my numbers, or your doctor's numbers for knows you release the translate to the hospital and in the hospital MAC way to come to release the follow the treatment and see the diagnosis. You have another questions? Yes?
Question. For heart attack patients, what are the type of, you have a full facility and all of the
Yes. Yes, I'm sorry for that. Yes, have the only MAC in San Miguel de Allende have the hemodynamia room or catheter room for help to release this treatment and have a good cardiologist to help to release these emergencies, heart emergencies. Yes.
I've had some comments about when people tried to call the hospital, there was nobody that could speak English. And that when they came to the front desk, there was only one person there and they were not bilingual. How are you addressing the expat community in terms of access to the hospital?
Hi, good morning. I'm Dr. Lim. So let me explain. Yes, we had a lot of complaints about that. So what happened is that now we have new staff. For example, we're seeing here Jesus. We also have Diana, that she speaks English. She's bilingual. She's also in the front desk. We also have Alicia, which also speaks English. Mary. So the staff that we had before has changed. So now you do have access for bilingual staff. Also, just in case, if there are some people that are not fully bilingual, there are always nurses, the supervisors, that at least one of them in shift speaks English and can translate. So that's something that we knew that has been going on, but now the staff has changed. Any other questions? I would like to add something with what Nori Contractor was asking. Hi, Nori. So what happens is that we have doctors that are in the office. So we have those doctors, but some doctors come from outside. So the endocrinologist, Dr. Montes, he comes from outside, but his office is in a different hospital. But if we ask for a consultation, like if you're hospitalized and I need an endocrinologist, he does go. He's part of the group of MAC, but he's not in San Miguel, he's in Querétaro. And talking about the cath lab, someone that asked that, so just for you to know, only in San Miguel, there is a cath lab. So for example, if you have to go to a different hospital, even private or public, if there is a heart attack, normally there's also an agreement with them that they would send you to hospital MAC, and then after doing the procedure, you go back to the other hospital. So it's important for you to know that we're also, together with different hospitals. But of course, if you're having a heart attack, we would recommend to be immediately in the hospital that has a cath lab and not like in the general hospital that then will send you to MAC. Yes?
We have a question on Zoom. It's in the event of stroke, do you have the capability to administer the clot-dissolving drugs?
Yes, we have that clot-dissolving drugs, and not only that, we can pull in the team where they can even do the intravascular clot buster, that it's like a neurology interventionist procedure because we have the cath lab. So the thing is that it's not only the clot buster that you just place in the first, 30 minutes to 3 hours. If you do that, you're just gonna avoid blood clots in the whole body. But what we can do in Hospital Mac with the cath lab is to go directly in the brain and the artery and do that clot buster, but specifically localized in that zone. And that's with interventional neurologists. The first patient that was done there was with Dr. Maxwell as a director in Hospital Mac, which started in 2015, is that correct? Oh, in 2017, it was the first time that they did the interventional neurology treatment for a stroke. Yeah, Dr. Maxwell? One moment.
We can also take advantage of the hemodynamic suite and remove the clot and do an angioplasty and put in a stent in the brain arteries. So that's another procedure that can be and has been done here in San Miguel. The other thing that has not been mentioned.
Robin is telling me that for Zoom purposes, you have to stand up in front, Dr. Maxwell.
I was just trying to complete what Dr. Lim was saying, and the other possibility that is available is a stroke is secondary to a clot that forms and blocks an artery. And what we can do is remove the clot, do an angioplasty the same way that we can do it in the heart, and put in a stent. So we diminish the possibilities of another narrowing of that artery. The other issue that has not been mentioned in this is that we have already been able to do open heart surgery in this hospital. So that's something that not too many people are aware of, but yes, we have that capacity to do stenting. We can do bypass surgery. In this case, it was a valve replacement. So yes, we can. And lung surgery, and lung surgery, obviously. Thank you.
Thank you. Yeah, TL?
Oh, no, ma'am, my bum was just.
Oh, it's because you're like going like this.
How extensive is your orthopedic care and surgery?
Okay, well, for example, there's two types of accounts, right? One will be the doctor's fees, and the other one will be the hospital fees. With the doctor's fees, it depends on the doctor, because some doctors can be just a general orthopedic, but others can be subspecialized, like an arthroscopy, hip, and so that changes. Also, it changes with the team that they have. Like if there's an anesthesiologist that comes in, if you're gonna have one surgeon, 2 orthopedics, 3 orthopedics, so that changes, which I couldn't tell you exactly how much the surgery is, but right now Cristina can tell you how much the operating room is and the rooms.
Yeah, the cost of the surgery will depend on exactly how many hours you may have to be on the operating room, and the cost of the rooms will be to $3,100 at night from the standard room to a $3,900 on a suite. Pesos? Yes, pesos. Yes, pesos. Yeah, so it will depend on how many days you may have to stay because of the surgery, or it might be an ambulatory surgery, which will be hours at the hospital at most. Yeah.
And also the flakes, if it's a hip replacement.
Oh, yeah. All the osteosynthetics materials that you may have to use for a fracture or maybe a hip removal or a replacement or something like that, that's also an additional cost that might have to be added to an estimate of the surgery that you may have or you may need. Yeah. So that's why it's very important for you to have a primary care, to be in contact with the right doctor and prevent, and if not preventing, well, to treat your injury or your disease right away.
Another question is if you have a rheumatologist.
Yeah, we do. We have Doctora Itzel is working with us, and she is on the hospital at the tower. Dermatologo?
Reumatólogo.
Reumatólogo? Yes, Dr. Felix, we have one.
Okay.
Yes. Any more questions? Yes, Mr.
Have you had any success in dealing with American Social Security?
Yes. Social Security?
Medicare.
Yes, yes.
Are you talking about Medicare? Yes, we do. So what happens is that, not specifically Hospital MAC is the one that accepts the Social Security of Medicare or Medicare Advantage. Yeah, don't worry. Okay, so, sorry. So the thing is that in Hospital MAC, not specifically MAC is the one that is going to do all of the, like the paperwork for Medicare. There's two ways to do it. As you know, if you have Medicare, you can have Medicare Advantage or you can have the normal Medicare with a supplemental. If you have Medicare Advantage, as you know, if you're out of the country, you can be covered by emergency. But there's two ways to do it. You do it on your own that you pay up front, and then Hospital MAC will provide you every single paper you need for you to reimburse that, because Medicare can reimburse you, maybe not 100%, but yes, maybe like a little bit around 80%. Or there are brokers. There are brokers that can do that, and what the brokers do is that they are the ones that will bill Medicare, and then after that, they are the ones that are going to pay up front. And if the patient has like an agreement with that broker, then that is when you can use your service. But I know that there has been a lot of doubt about that, because the thing is that that service is accepted, but if Medicare knows that that patient lives in the US, so many don't live in the US, you're even residente permanente right here. So the thing is that if they notice that, it gets canceled. Yep. There's going to be a medical talk here of Bibloteca. It's going to be on August 31st. We don't know exactly the hour, but they're going to be talking in the medical panel about the insurance, about how you can use it here in Mexico. So I think it would be good for you to go. Any other question?
Yeah, we have another one on Zoom. All of your specialist boards certified similarly to the United States?
Yes, what happens is that here in Mexico, there is something that is called Consejo Mexicano and of the specialty. So for example, me that I'm an internal medicine doctor plus a critical care, I am board certified in two of them, in internal medicine and in critical care, as Dr. Maxwell and everyone else. So the thing is that the standards of care for you to be in Hospital MAC, all of the directives, you have to put in your papers and you have to be, like updated. If you're not, you can't be part of the role. What is that? That, for example, if you're a surgeon and suddenly they're going to put you on call, but you don't have your papers, they can't put you on call. So all doctors that are in Hospital MAC, for sure they're certified because it's part of what has to be done to do the correct things, right? So they're all certified, yes. Of course, it's not the same certification in the US than the one here in Mexico, but it's the same. It's board certified. Any other question? Yeah, Dr. Maxwell, were you going to say something? No? No questions?
Thank you. What's that?
Ask something else or something?
No, well, I just wanted to say, obviously, we know what's important to us, breaking a hip or having a heart attack. We're all good-looking people, so we're not looking for plastic surgery or planning on having any babies soon. But
primary care, yes.
She's going to talk about the primary care. And then I think I'm giving her one of our fancy mugs, right? Which they're all going to have to share. Okay, go ahead, Doc.
Okay, so this is very important because I know where the question of the orthopedic surgeon comes to. The question that you were asking before, because I know about the case that had to be sent to the general hospital, and thanks to other groups, NGOs that helped, then there was that replacement, hip replacement. So why is it important to have a primary care? Because here in Mexico, that doesn't exist. Like, for example, we are primary cares because we are like doing the same thing that they do in the US or like in Canada. But here in Mexico, if a Mexican has a heart attack, they're gonna call a cardiologist. If they have a problem in the hip, they're gonna call the orthopedic surgeon. It's not like they call a primary care. But the thing is that many doctors here have adapted that, as you know, Dr. Maxwell, many others, that if you have a primary care and you have a problem, you first call your doctor, and your doctor will be able to arrange absolutely everything. Let's talk about a hip fracture. If suddenly you're in your home and you fall down and you can't move, you call your primary care, and that way when you call your primary care can call the ambulance for you, so that way you don't have to do anything but just to get all your papers and go to the hospital, instead of you trying to call 911 with the Red Cross, that they don't speak English, not all of them, and you have to answer so many questions of past medical history. Like if you say, "Hi, I fell," they're gonna say, "What's your full legal name? How old are you? What is your date of birth? What is your blood type?" And they ask many past medical things that are time-consuming. So the thing is that if you have a primary care and something happens, that doctor will do everything for the emergency and also pull in the team. Don't forget that it's Mexico. It's not the same as the United States or Canada. If you have a patient, if you suddenly go to the dermatologist, don't think that that dermatologist is going to tell your primary care what you had. It goes through the patient. The patient is the one that has to say, "I went to the dermatologist and she made me a Mohs surgery. And then I went with the hip doctor and I got my hip replaced." Because we're not like connected in the private practice. So it's important for you to know that if you have a primary care, that doctor is the one that will pull in the team, so that way you're always the same group in the loop. To me, that is very important, because then that is when patients are jumping from one side to another and they don't even know what to do anymore, because now they have like 6 primary cares, you know? One for thyroid, one for the heart, one for the hip, one for the liver. So that is why Hospital Mac is trying to promote that, because they have that concept, which is part of a US concept in Canada, of primary care, okay? Any questions about this part of primary care? TL?
Grace is my doctor. So if I go to a dermatologist, I need to tell you?
For example, when you told me that you had a problem in your sinus, I was the one that sent you to the ENT. So me sending you to the ENT, they did you the surgery, I did the preoperative evaluation, I know what they did to you, I have it in the file, I have it all together, you needed help for the insurance because you had VUMI, we gave you all of the information, but if you would have done it on your own, and you would have gone to the ENT, and you tell me, "Dr. Lim, you know what, like what you needed, I need this format of the insurance. I need these laboratory tests. I need to speak to the doctor because I didn't understand something," I would have said, "Well, TL, you didn't tell me. I don't even know. Who's the one that operated you?" And they're not going to tell me. You know what I'm saying? So the thing is that you must be referred by your own primary care. So when you say, "You know what, I have something in my skin," "Oh yeah, go ahead, TL, go here," or it's very different for you to call than for me to tell the dermatologist, "Guess what? TL has a mole, a high-risk mole, that suddenly it's growing, it's ulcerated and bleeding, so they're gonna fit you in quicker because it's a referral from a doctor." See? So it's very different. It's very different for you to try to manage it on your own than to go through your primary care that fits you in with the team. Yes? Wait, one moment.
So if you've already kind of messed it up by beginning things on your own, how do you fix it and get...
It's normal. For example, it's not that you did it wrong. It's normal. I mean, that's how you do it in Mexico, right? But I recommend you, if you say, "Okay, I have a thyroid problem plus, I don't know, you can say a heart problem, and now I have like 5 doctors." Then you can make an appointment with Dr. Maxwell, that he is just here besides the Bibloteca, that's where his office is, and you say, "Dr. Maxwell, I need to establish a relationship." So you sit down, you show him everything that you have, he checks it, he makes a file, he asks all of the questions, he puts it in a digital file, and then he already knows your past medical history. Now, you say, what am I going to do? Because this is very common. Your doctors do not answer in Querétaro, or they don't answer in Celaya. That is so common to happen, that you keep on calling and calling, and they don't answer, and they say, well, I don't know, because they're not going to say that it's a priority, a patient that is outside their city. So in that moment, Dr. Maxwell will say, okay, you're going to say, you know what? Now it's time for me to have a mammogram. And so Dr. Maxwell will say, okay, go here. And the moment he refers you to that place, immediately he's going to get the results. So he's going to put it in your file. So that's what you have to do. Have a primary care. Yes, Nori?
So now I think the question is, how many people in the room do not have a primary care physician? Only, okay. Okay, this is a good crowd. Good, good, good. Because you need that. You need that. You get it?
Just to illustrate this point real quick, another really important practical reason to have a primary care physician, and one that's affiliated with a hospital you trust, is because sooner or later you're going to need medical care, and you're going to need it quickly. And if you don't have a relationship with a doctor that has a relationship with a hospital, it's going to make your life difficult, right? So, and when you have that relationship, your doctor has all your insurance, has all your information, and they can just take care. You make, like Dr. Gray said, you make one phone call and it's taken care of, as opposed to walking in there in an ambulance when no one knows you and who knows what's going to happen to you.
Dr. Maxwell wanted to add something?
Yes, in my experience, there's many patients that I have seen in my office that have a primary care. And the problem with that primary care is that primary care is a GP, and it's not affiliated with any hospital. Or not only that, he only works from 10 to 5. And it's 10 o'clock at night, and you do not know who to call because he will not answer your phone call. So you, in that selection of your primary care, make sure that he's affiliated and has a support group of neurology, cardiology, orthopedics, the most common problems that this population of expats is gonna have.
And also I would like to add that in Hospital MAC, if you want to be admitted, it has been already said, because it's part of the board certification, that a general practitioner cannot admit a patient in a regular room. It always has to be a specialist. So for example, if you come to Hospital MAC and your general practitioner is a general practitioner, and suddenly you come because you have an uncontrolled diabetes, that general practitioner cannot admit the patient in a regular room. He always has to ask help for or an endocrinologist or an internist, or if it's in a critical care condition, like we're talking about, like acidosis, diabetic ketosis and all that, then a critical care doctor, because it goes to the ICU. So it's very important for you also to take that in consideration, because if it's a general practitioner, they do not have credentials to admit a patient.
I just want to say one more thing, and I was not paid to say this. I have been there. I know we only have 1 second, so I'm going to wrap it up, and then Joe's going to close it, and then they'll be out here to answer additional questions and maybe give away goodies. But I've been there on an emergency basis in the middle of the night, and my doctor was out of town. In fact, she was out of the state. And they arranged for somebody to see me before 5 in the morning. Number two, I filed an insurance claim, and although I had to go pay to get it translated, my insurance, which is a Medicare Advantage plan, paid every penny. And number three, I was there one day, and I said, I know you're going to give me a shot, but look here, I've got this funny stuff. I mean, what do you think this is? And the doctor I saw said, oh my God, every dermatologist in this town is booked for the next 3 to 4 months. Let me see what I can do. You can see here at 1:15, it's now 11:30. Will that be all right for you? So the referral worked immediately because I was in the MAC system. So again, I'm not paid by these people, but I wanted to verify 3 facts. Here you go, Joe.
Okay. Thank you. We're going to try to wrap this up. Thank you, everyone, for coming today and answering all these questions. I'm sure they have more questions. You know to go to the website. You can call them directly. I'd like to have one of you come up to accept a, well, all of you can come up and accept a mug. There's 4 of you. We've got plenty. All right. Doc, thank you very much.
Thank you very much.
There you go.
Thank you.
When you drink your coffee, have some coffee on us. Thank you very much for coming today and speaking to our club. One's for Doc here too. Okay, Doc. There, you can put your coffee in there now. Does anyone, Doc?
Thank you very
She's
much.
got more
I've
stuff
never
from
had
us.
a cup. That's awesome. I have my award, but not the cup.
Thank you very much. Thank you very much for coming. All right. Have a great day, everyone. The meeting is over.